decision that's best for you, and I fully support that. No is a complete sentence. Do I have your full and informed consent to continue with the procedure? Now, these phrases may all sound like I'm on some sort of an activism rampage or like a big propaganda of some sort, but that's not really the point of this video. So over the last few weeks, we have been looking at the concept of informed consent and patient autonomy. And this week, we're putting a more positive spin on that. So in other words, what should we be demonstrating in our actions and also doing and saying in our words in order to respect and also enforce patient autonomy? So last week, I highlighted all the negative things that healthcare professionals, some tend to do unconsciously, which sort of goes against the whole concept of respecting patient autonomy and letting them basically be in charge and take control of their body and their health. Whilst healthcare professionals are mainly there, their job is really to support and facilitate whatever the patient wants to do with their body within the framework of what is safe, healthy, and acceptable. The problem, as we discussed over the last few weeks, was that we tend to, as healthcare professionals, unconsciously bring our preformed biases and opinions and judgments in relation to what informed consent and patient autonomy is. So that's why people who are in the healthcare space, particularly as I highlighted in the past, when it comes to pelvic examinations, reproductive scans, and letting women who have a uterus decide what they want to do in terms of getting sterilized or having hysterectomy or being tested for endometriosis or whatever it may be. These are the things that we looked at in the last few weeks, just to unpack what we as healthcare professionals tend to do very unconsciously in order to sort of sabotage their experiences. And that again really leads to that lack of trust and credibility of you as a healthcare professional. So, first thing that you can do in order to respect and reinforce patient autonomy as a healthcare professional is, obviously, and I say this all the time, repetitively like a broken record, listen actively to what your patient is saying. Don't use the opportunity to jump in, fix anything, or give your judgment, give your opinion. Just listen to them actively. Yes, make a record of what they're saying, take notes, but also acknowledge what they are saying in terms of why they are choosing to do whatever they are with their body, with their health, or whatever the procedure is. So number two is a big one where, even though I've said it in the past, in the beginning of the video, your body, your choice, it's really giving the patient the control and the autonomy that they really need. So you may not necessarily have to say your body, your choice, but you can always validate by saying, you've made a good choice that is best for your health and for your body. And I will do whatever I can in my power to make sure that we see through this in a healthy and sustainable manner. So what they're really looking for is your support, your guidance in the space of the whole medical health factual framework, and without any bias, opinion, or any sort of judgment. Number three would have to be when you are actually agreeable to what the patient is wanting to do in terms of the procedure, in terms of the scan, in terms of the test or anything. You have to take them through step by step, both in writing and verbally, what the process will entail. And again, take them through it very slowly, explain every step, step by step, bit by bit, give examples if you have to, and let the patient ask as many questions as possible. Once you have given them the whole transparent, complete picture, ask more than once, and healthcare professionals do this anyway, but ask more than once. Do I have your full and informed consent to go ahead with the procedure? And the very last one that I'd like to highlight, which I said in the very beginning of the video, and this can be perceived in more than one way. So, very famous saying, no is a complete sentence, and I've mentioned this in my past videos many, many times. So just like if you say to a patient that you decline or you say no to granting them a test or a procedure or anything, if they say no, that's what it means. That it means the same thing. That it's no, it's a complete sentence. They mean no. and you have to respect that, just as if you want them to respect your no, you need to be doing the same thing. Now that could be anything. That could be if they don't want to have a scan or a procedure or test done or a surgery done in a certain type of manner, and they say no, you have to respect that. You have to say, okay, so if you don't want to do that for whatever reason, depending again if there is medical scientific reason for why they may be declining it, there's nothing wrong in asking for that. But if they give you a concrete answer, try and respect that and offer them. So these are some of the things that we can do on a positive basis in order to respect and reinforce patient autonomy as healthcare professionals. Now, I do admit that we have a very long way to go in terms of actually putting this into action, because we have seen, especially in many parts of the world, where women's bodily autonomy has been put in the hands of men in the government, and they are not really being given that option to take control of their body. But at the same time, so as long as things like pronatalism, patriarchy, and really old-fashioned textbookish methods exist still, and people still swear by it, and that's considered the Holy Bible, really to do something this unconventional and this out of the norm, and for it to be accepted, will take some time. But we can all, as healthcare professionals, take small steps in order to be trailblazers and set the right path in the right direction in order to build a better relationship with our patients and give them the best experience of care and treatment by respecting and acknowledging their bodily autonomy without letting our biases and our opinions and our judgments get in the way when we're trying to work with them. My name is Shweta. I'm the founder of Healthy Dynamics. We are a coaching practice that help healthcare professionals from non-English speaking countries become better communicators and build better relationships with their patients. So hope you found this video useful. Next week's video is going to be about the concept of respect, something that I actually listened to in a podcast, and the different varieties of respect and how that can be used in the space of healthcare with our patients. So hope you enjoyed this video. Leave it a like and some comments below, whatever you found useful, and share it to whoever you might think is going to be useful for, and I will see you next week, same time.